Let's return to the science by going back to our interview with Sir Peter Gluckman. And in a way, this is where the science meets the politics, because although his work is independent, he is the Prime Minister's chief science advisor. So how did he get involved?
My office is very small. I only have 3 research staff, so that we choose to do, by discussion with the government, those things are their priorities or where we suggest a priority. And in a discussion when I had an introductory meeting, as I did with a number of ministers, I had a meeting with Mr. Twyford, we came to the conclusion that this was something that was worth a fresh look, that he suspected there was a problem here, and I agreed to pick it up and have 2 of my 3 team work on this for most of the last 6 months, because we were also aware in doing this report that A, we're dealing with human health, B, we're dealing with an area where there's been an enormous amount of public concern, C, it's an area where the cost to society of being wrong in our advice either way would be important. So Anne Barsley, in particular in my office, has done an immense amount of research, has spent hundreds of hours on the phone internationally and nationally talking to the various stakeholders, including the testing industry, as well as looking at the scientific evidence, as well as talking, and the report, as you will note, is externally peer-reviewed by experts, and that is the conclusion we came to as the report.
As you were looking at this and taking stock and realising the extraordinary gulf, disparity between what was being said and what was actually the case, what was your reaction?
Surprise at one level that the faulty logic along the way had been missed. Not surprised at another level, because we are not very good in New Zealand in general at getting external scientific inputs at key points into policy processes, and we're getting better. And hopefully there's a lesson in this, not just for this government, but for all governments and for the policy community, that good quality scientific review is often very helpful in getting the right policy choices. And here we've had a situation where the value of independent scientific advice, independent of vested interests, has shown that, is, I think, well demonstrated.
And I just want to come back to that independence because it's so important. So the first discussion you had with the government about looking at the level of 0.5 and whether that was a justifiable or rational level was with this government after the last election.
Yes, it had briefly emerged in a discussion late in the course of the last government, but probably not at the right time in terms of the workload I had on me already. I've got to be careful to say that the discussion didn't focus on the 0.5 level, John. It was simply, we agreed it would be worth me looking again at whether we were doing the right thing around methamphetamine and housing. And so there was no discussion of levels, no discussion of standards, no discussion of process. We were just going to I agreed to take a zero-based look at the whole issue of methamphetamine testing.
So that agreement was with this government.
Correct.
The end of the last government, who were you talking to?
Prime Minister's Chief of Staff was my last conversation on that.
And did you talk to any ministers in the period of, say, 16, 17?
I honestly can't remember. I'm not ducking it. The reality was that it was not. I mean, as I said, I've got very limited bandwidth, and I did what I could. I was pretty busy, and with only a staff of 3, there's so much we can do.
Sir Peter Gluckman speaking to us earlier. Just before we move on, we began with Casey McCarry, Robert Eruiti's daughter, talking about his case, evicted for a very, very low sample in 1 of 8 rooms tested. That was 0.59. The minimum sample was 0.5. 58 weeks. In emergency accommodation, total cost of $44,000, and he is paying some of it back. We're trying to confirm exactly how much Robert owes MSD for his emergency accommodation post-eviction and how many other people are in a similar situation. The Ministry is working on getting that information to us, and we will bring it to you when we get it, although I suspect it will now be next week.